Greetings and welcome to the webinar on the 2021 Physician Fee Schedule Final Rule. The presenters today are APTA Government Affairs staff Justin Elliott and me, Kara Gaynor. Today, we will review the 2021 Fee Schedule Final Rules impacting physical therapy and discuss congressional advocacy to stop the 9% cut. So let's dive into the Fee Schedule Final Rule policies for 2021. First, I do want to mention the 2021 per beneficiary threshold amount is increased to $2,110, up from the 2020 threshold of $2,080. Now, within the final rule, CMS indicates that it is moving forward with cuts to dozens of healthcare providers, including physical therapy, as a means to offset the increases to the office outpatient evaluation and management visit codes, which are billed by primary care physicians and some specialty providers. Now, CMS is moving forward with this despite pressure from both Congress as well as stakeholders, including APTA, among dozens of other national associations. Now, during the comment period on the 2021 Physician Fee Schedule proposed rule, which began in early August and ended in early October, APTA submitted 2 comment letters detailing why CMS shouldn't move forward with the deep cuts. We also initiated provider and patient sign-on letters. We met with CMS, HHS, and the Office of Management and Budget, along with AOTA and ASHA, and we initiated a strong grassroots effort, amassing more than 25,000 letters to CMS, urging the agency not to move forward with the cut. While CMS did not listen to the physical therapy profession or any of the other dozens of healthcare professions, it's important that we had such strong vocal opposition because it illustrates to Congress that this is an issue of great importance to these professions and the patients they treat. There was overwhelming opposition to the cuts, and clearly CMS did nothing. This therefore puts the onus on Congress to fix these cuts, which Justin will talk about in a few minutes. Now, regarding how CMS is implementing the cuts, Medicare uses a physician fee schedule to determine payments for approximately 10,000 services. The fee for each service depends on its relative value units, or RVUs, and RVUs define the value of a service or procedure. To determine the Medicare payment amount, a service's RVUs are multiplied by a dollar conversion factor. So the estimated 9% cut to payment is a result of CMS adjusting the conversion factor downward for 2021. The calendar year 2021 physician fee schedule conversion factor is $32.4085, a decrease of 10.2% from the 2020 conversion factor of $36.0896. It is listed in Table 106 in the 2021 Physician Fee Schedule Final Rule, where it lists the estimated impact on total allowed charges by specialty. I've pointed out on the slide where physical therapy and occupational therapy are listed with a corresponding minus 9% cut. And it's important to note that SLP, although not mentioned, is included in that as well. Now, this slide shows an excerpt of the final RVUs for some of the codes used by PTs as compared to 2020. As you can see highlighted in yellow, many of the codes would see small increases in value to their RVUs, some of them more significant, particularly the evaluation and re-evaluation codes. Now, CMS adopted significant increases to the eval and re-eval codes because CMS identified them as analogous to the office outpatient evaluation and management services, in that they believe that a significant portion of the overall work in the eval and re-eval codes is for the assessment and management of patients, as it is for the office outpatient evaluation management visit codes. So CMS felt it important to revalue the eval and re-eval codes to reflect the overall increase in value associated with spending time assessing and managing patients, as reflected in the changes to the work values for the office outpatient evaluation and management visits. Now, despite these individual increases to code values, the drastic reduction in the conversion factor, which is, as I said a moment ago, is used to calculate the payment amount for each code, is what has led CMS to estimate the 9% combined impact reduction in reimbursement across the three therapies. However, I want to emphasize, as CMS emphasizes in the final rule, that the actual impact to each provider will vary based on billing and practice patterns. Now, switching gears a little bit, I do want to share that as of January 1st, 2021, physical therapist assistants are permitted to provide skilled maintenance and rehabilitative treatment in the Medicare Part B settings. The change to allow PTAs to furnish maintenance therapy was included in the 2021 Physician Fee Schedule final rule, where CMS said that they would be permanently allowing physical therapists to delegate maintenance therapy services to a PTA for outpatient services under Medicare Part B. And CMS will be updating the Medicare Benefit Policy Manual, Chapter 15, Sections 220 and 230, to clarify that PTs no longer need to personally perform maintenance therapy and remove the prohibition on PTAs from furnishing maintenance therapy. And of course, PTs and PTAs still are expected to abide by existing rules that require the use of the CQ modifier when services are provided in whole or in part by the PTA. Now, other policies included in the final rule included a permanent allowance to allow physical therapists in private practice to furnish and bill communication technology-based services, specifically remote assessment of recorded video or image, virtual check-in, and e-visits. And these were first allowed by CMS during the public health emergency, and CMS then proposed and has now finalized the proposal to permanently allow physical therapists in private practice to furnish and bill these services under Medicare. Now, I will note that we are seeking clarification from CMS regarding whether these codes can also be furnished and billed by facility-based therapy providers on a permanent basis, or whether it's truly only allowed by physical therapists in private practice. Now, we also wanted to give you an update regarding telehealth services. Between now and the end of the COVID-19 public health emergency, the Medicare telehealth services list that physical therapy providers have been following is in effect, and PTs and facility-based physical therapy providers can furnish and bill those telehealth services that are included on that list. And the eligible telehealth services list does include CPT codes 97530 and 97542. Now, once the PHE is no longer in effect, the temporary policy permitting PTs and facility-based PT providers to bill telehealth under Medicare ends, and telehealth furnished by therapists once again becomes a non-covered service under Medicare. However, in the fee schedule final rule, CMS did establish a temporary Category 3 list of telehealth services that will take effect once the PHE ends. And so as a result of APTA advocacy, some of the therapy codes have been added to this temporary Category 3 telehealth list. However, I do want to clarify that by adding the therapy codes to the Category 3 list, CMS is not extending the eligibility of physical therapy providers to furnish and bill telehealth. In fact, the only scenario in which PTs could furnish telehealth services and actually have it billed under Medicare would be those therapists who furnish services incident to the physician, and then the physician bills those services, since the physician is an eligible professional regardless of the public health emergency. So we really need Congress to pass legislation that permanently adds PTs and PTAs as eligible telehealth providers. Because if they don't do so before the COVID-19 PHE ends, then telehealth does become a non-covered service, even though some codes have been added to this temporary list that is in effect once the PHE ends through the calendar year in which the PHE has ended. So, APTA did advocate for the inclusion of therapy codes to this list for a couple of reasons. We obviously knew that this would not extend the policy of allowing PTs and facility-based PT providers to furnish and bill telehealth, but rather by including the therapy codes on the list, CMS is then publicly saying that there is evidence to support the clinical benefit of telehealth services furnished by PTs and PTAs. And this really helps with our advocacy to Congress as well as commercial payers. And we also felt that by CMS adding these codes to the list, it could allow for a more seamless transition once Congress passes legislation adding physical therapists and physical therapist assistants as eligible telehealth providers under Medicare. Now, in an effort to limit COVID-19 exposure for the duration of the public health emergency, in the spring of 2020, CMS adopted an interim final policy that revised the definition of direct supervision to include virtual presence of the supervising physician or practitioner using interactive audio and video real-time communications technology. And CMS did clarify in May that this temporary policy did apply to private practice PTs and PTAs. So in the final fee schedule rule, CMS stated that it's extending this policy until the end of the calendar year in which the COVID-19 public health emergency ends. So they're expanding the policy that they set in place earlier this year. Now, overall, CMS isn't making drastic changes to the MIPS program, but a few things to note. CMS did adopt a performance threshold of 60 points rather than the proposed 50 points for the 2021 performance period. And CMS said in the final rule that they were adopting the 60-point threshold because they wanted to ensure that there are appropriate incentives for clinicians, including those with small practices, to continue their participation in MIPS for the 2021 performance period, even if the COVID-19 public health emergency continues. And it's also their intent to prepare clinicians for participation in MIPS beyond the PHE. And they believe that maintaining the performance threshold at 60 points for the 2021 performance period and 2023 payment year would align with the increasing standards for performance necessary for successfully participating in MIPS in future years. CMS also added to the PTOT measure set 2 process measures for dementia, and they added MIPS eligible physical therapy clinicians to measure number 226, preventive care and screening, tobacco use screening and cessation intervention. For the 2021 performance period, CMS is continuing to reweight the promoting interoperability and cost categories for PT. And CMS is delaying the shift to the more streamlined version of MIPS, which it has dubbed the MIPS Value Pathways, or MVPs. And as a result, MVPs won't be available for MIPS reporting until at least the 2022 performance period or later. I'll now turn it over to Justin to review our Capitol Hill advocacy regarding the Medicare payment cut. Justin?
All right. Well, thanks, Karen. Hi, everyone. This is Justin Elliott, Vice President of Government Affairs at APTA, and I'm going to talk briefly today about what we can expect potentially over the next 2 weeks up on Capitol Hill as we work to address the impending cuts to the Medicare fee schedule. We can go to the next slide. So with the release of the final 2021 Medicare fee schedule, it's now time for Congress to intervene. APTA, along with our coalition partners, have been advocating to Congress for over a year on this issue. When CMS first released this proposal and rolled it out in 2019, APTA began working both alone and in concert with other groups to really educate and advocate with Congress about this proposal from CMS, and to alert them that it appeared that CMS was going to, what seemed pretty intent on moving forward with their E&M code proposal, and also talking to them about the devastating impact it would have on the 36 healthcare provider groups that are facing deep cuts to subsidize increases for primary care. So our message has been and continues to be that Congress needs to intervene. Now, prior to the release of the final rule last week, a number of members of Congress have individually and collectively had applied their pressure to CMS, asking CMS to reconsider, rethink, redo this E&M code proposal in the fee schedule rule. We saw Senators Tester, a Democrat from Montana, write a letter to CMS expressing concern about the impact it would have on therapy. Senator Collins, a Republican from Maine, also expressing concerns. 161 members of the U.S. House, bipartisan, joining forces to weigh in to CMS But as we all saw with the release of the final rule, CMS ignored the comments from thousands of providers, patients, and members of Congress, did not change the rule. And now as a result, Congress needs to act. It needs to act before the end of the year. Let's go to the next slide. So again, APTA has been advocating on it, but we haven't been alone. As Kara mentioned, there are over 36 healthcare provider groups that are also facing steep cuts. And what you see on your screen is just a small sampling of some of those groups that we have been working in coalition with, working with the American Medical Association, working with our therapy partners at AOTA and ASHA, working with the radiologists and pathologists and orthopedic surgeons and a whole host of providers who are impacted. And again, working alone, but also collectively, we have been advocating for Congress to intervene. And over the next couple of weeks before the end of the year, this is going to be our sole focus, as it has been for the last several months. We can go to the next slide. And so I know as many folks who are watching this have been involved, this has been a big issue for APTA over the past year. You know, just looking at since March 1st, APTA, we've attended over 350 Hill meetings with staff and 300 and political events with members of Congress, where we've been able to talk to staff, committee staff, and members of Congress about this issue. APTA has also had meetings with Speaker Pelosi in the House, and of course Senate Majority Leader McConnell, as well as meetings with those key congressional committee staff or committees that are going to be driving the bus on this issue. You know, the three main committees on Capitol Hill that have jurisdiction over this are the House Ways and Means Committee, House Energy and Commerce Committee, and the Senate Finance Committee. And again, APTA, both individually and collectively with other groups, have been working hard to educate these committees of jurisdiction about the need and possible options to intervene. Of course, I do want to give a shout out to all of our APTA member advocates, our federal affairs liaisons and key contacts who have also had meetings with their members of Congress, particularly in August during the congressional recess. And as folks have seen, we've done a lot in terms of grassroots. And I know a number of folks, again, have participated in the virtual rallies that we've held. We had one back in September. And of course, we had just one last week, generating over 120,000 emails and letters total to Capitol Hill. I would like to give a shout out also to PTPAC and those APTA members who have supported PTPAC. PTPAC's role in this, our Political Action Committee, has been critical in making sure that we're able to get in front of members of Congress and explain to them this issue. We can go to the next slide. So we've also been working just in terms of media and public relations, particularly with Capitol Hill publications, trying to cut through the noise. 2020 has been, as everyone knows, an odd and challenging year. And Capitol Hill has just had a lot of issues that they've been trying to manage and juggle. You know, everything related with the pandemic and trying to put together COVID relief packages. We've had the issue with the Supreme Court vacancy. This was a big election year. So there's been a lot of noise and a lot of issues up on Capitol Hill. But the good news is that thanks to our APTA member advocates and the work that you all have done and our partners in the coalition, we've broken through the noise and made sure that members of Congress know this is an issue. And really pushing back on CMS also with the regulatory advocacy that Kara mentioned. The issue here now is that Congress is well aware now that CMS is moving forward, that these cuts are going in on January 1st, and 36 different provider groups are going to be negatively impacted. And then just on top of that, the idea of making cuts and such deep cuts to so many providers during the middle of a global pandemic just is not good healthcare policy. So it's on the what we call top of the pile of issues that they need to address. The question is whether the timeline and political will and opportunities are going to happen between now and December 31st. So let's talk about what are some options and what are some of the bills that APTA has been working on. Well, first is HR 8702, which has been introduced in the U.S. House of Representatives, sponsored by Congressman Ami Bera, a Democrat from California, and Congressman Larry Bucshon, a Republican from Indiana. As of this morning, there are 83 bipartisan House members who are supporting this bill. I'd also point out that along with APTA's support for this legislation, There are over 380 national and state associations and organizations and entities that have endorsed this bill. So this bill has wide bipartisan support, a large number of healthcare associations and provider groups and organizations who support this. What this bill would do is basically provide a 2-year reprieve on the scheduled cuts. It would allow the increases to go into effect for primary care providers, but it would basically put a freeze on the cuts to those providers. Now, what it would do for those providers who are facing cuts like PT, OT, and speech, it would provide a COVID relief payment, a hold harmless payment that would basically make whole those cuts. So the idea being is if this bill was to pass, at least through the end of 2022, physical therapists would not see a 9% cut in their payments. It would be stable for at least 2 years. And the name of this bill is the Holding Providers Harmless from Medicare Cuts During COVID. The reason that, again, this bill is being framed as, again, the idea of making cuts during a pandemic is not good healthcare policy, and Congress needs to intervene and at least for 2 years, prevent these cuts from happening, hold harmless those providers who are scheduled for cuts. Now, this bill does have a price tag to it because, again, to subsidize and prevent these cuts from happening, Congress needs to find money to provide this hold harmless payment to providers. And that estimated cost is approximately $11 billion. And so the challenge right now is to identify $11 billion that could be rerouted and help fund the cost of HR 8702. But again, this is the legislation that APTA and a number of providers are supporting. We've not only been asking members of the House to join as co-sponsors, we've been telling members of Congress to push 8702 with House leadership, with Speaker Pelosi, with Kevin McCarthy, the minority leader in the House, and with key committee chairs like Chairman Pallone, Democrat from New Jersey, who chairs the House Energy and Ways Committee, Energy and Commerce Committee, and Chairman Neal, who chairs the House Ways and Means Committee, Steny Hoyer, the floor leader. I mean, these are all the folks who are going to be really looking at what's going to be in any year-end package. And so our message is not only for our members to ask them to join as co-sponsors of 8702, but make sure that their member of Congress talks to their party leaders and make sure that 8702 is included in any year-end package. We can go to the next slide. There is another bill that is in play right now, HR 8505, sponsored by Congressman Michael Burgess, Republican from Texas, and Congressman Bobby Rush, Democrat from Illinois. This legislation would provide a 1-year delay to the proposed cuts, and it would do so by doing what we call waiving budget neutrality. This bill would also come out, and the cost of this, what's interesting, it provides a 1-year delay. It costs about the same amount of money as 8702, but this one actually does identify where they would take the money from to subsidize this. Again, we're looking at a $10 to $11 billion. And in this case, with the 8505, they would utilize money that was set aside for the Provider Relief Fund and the unused funds for that. APTA, we support this bill, but we believe that HR 8702 is the preferred policy solution. We want that 2-year delay that is provided in 8702 because we believe that we're going to need at least 2 years to work with CMS and Congress and other stakeholders to come up with an alternate option to these fee schedule cuts. And so again, a 2-year reprieve, and also with the current situation with the COVID pandemic, we need at least 2 years of recovery. And so again, 8702 is our preferred vehicle, but we are not opposed to 8505, and we appreciate Congressman Burgess and Congressman Rush for their support and work on this issue. We're going to go to the next slide. But we do have a couple developments just in the last couple of days. This is a letter that was just released on Friday, led by Congressman Bobby Rush, who's been such a huge supporter of physical therapy and who has been a leader on these Medicare cuts. He wrote a letter to Speaker Pelosi and Leader McCarthy in the U.S. House. He led a letter that was signed by 26 members of the Congressional Black Caucus, basically telling House leadership that, in these year-end packages that they're working on, that they really need to either include 8505 or 8702, either one of them needs to be included in the year-end package to prevent these cuts from being taking effect on January 1st. In addition, and we can go to the next slide, this letter, which was just released, made public this morning, this was a letter to Senate Leader McConnell and Minority Leader Chuck Schumer. It was a bipartisan letter led by Senator Stabenow and Senator Menendez, two Democrats, and Senator Daines and Senator Boozman, two Republicans, signed by 46 additional U.S. members of the Senate, 50 U.S. senators, bipartisan, signing onto this letter, telling Senate leadership that there needs to be action to prevent these cuts from taking effect on January 1st. And so again, we're beginning to see more pressure from our congressional allies and really pushing Capitol Hill leadership, both in the House and the Senate, to include a fix in any year-end package. And again, either we would prefer 8702, but as noted, 8702, 8505, both of them would provide a solution. And we can go to the next slide. So what does this look like in terms of timeline? So we are recording this webinar on Monday, December 7th, at the start of what promises to be a very unpredictable and very unusual week in Congress. What we see is on December 11th, at midnight on December 11th, the government runs out of money. And so Congress must act before Friday at midnight and pass an omnibus spending deal. That will keep the government open and keep keep the different federal agencies open. And so Congress needs to come together, pass a bipartisan omnibus spending deal. Now, there was one option or one scenario that could happen is that Congress could potentially do a 7-day patch, basically kick the can down a week to Friday the 18th, or maybe some other date afterwards, where they would have to get their omnibus spending bill passed. Either way, it has to happen before the end of this year, or else again, the government will shut down. And so that is one of the vehicles, since it's a must-pass spending situation, that we were looking to have HR 8702 hooked on to be included in that year-end package. The other potential vehicle is there is renewed talk of another COVID relief package, something that Congress has been mulling over since May. And with the current situation, with the increase in infections and the concerns about the U.S. economy, there is added urgency now on both sides of the aisle to do something with a COVID relief package. And so that is something that could also come into play either this week or next week, again, depending on how the dynamics up on Capitol Hill shake out. So we're looking at both of these as potential vehicles, as must-pass legislation that we could attach HR 8702 or some other option, a policy option that would prevent these cuts from going into effect. The other thing we are hearing is that we may see Congress merge the omnibus spending bill with the COVID relief package and have this gigantic legislative vehicle and try to get that through as well. But what it all comes down to is timing, money, and political will. Will Congress act in time? Will they be able to find the funding to offset these cuts? And will they have the political will to do it and to do it quickly? Because the other option is that they could end up maybe not including it in a package, in which case they will have to address it when they come back in January 2021 under the new 117th Congress. There are a couple of variables also in play that we are watching. First, obviously, is the situation with the U.S. Senate. We have 2 Senate seats that still need to be face a runoff on January 5th, and that is playing into some of the politics, both in this year-end spending deals, and will also be a major factor in January when Congress comes back. The other thing we're watching this week in particular that will also be a major factor is that Congress needs to pass this defense spending bill known as the NDAA. It's a major bill. There are some issues now with it and threats of possible veto. That is something that also is a political variable that could play into the timeline and ability of Congress to get any type of year-end package done, including 8702. So stay tuned, because over the next 14 days, we are going to see a lot of activity and unpredictability up on Capitol Hill. Let's go to the next slide. So what can you do? First of all, thank you to all the members who have contacted their members of Congress, who have written, who've called, who have participated in our virtual rallies. Again, your voice has made a huge difference in cutting through the noise and getting this issue top of the pile for Capitol Hill. Our message is to keep it up. We have to just keep the pressure up. Even if you've already written, called, or emailed, or tweeted, keep doing it because we need to keep the noise going and keep the pressure on. Again, we're doing grassroots. A number of the organizations who are part of our coalition, we're coordinating with them, again, to have maximum impact on getting through to members of the United States Congress. But I do want to say again, thank you for all of your ongoing advocacy. This has truly been a marathon, not a sprint, and we're going to keep the pressure on, keep their feet to the fire until we get a solution to these proposed cuts. We'll go to the next slide. So we do have some additional resources. Again, these information about not only what's in the final fee schedule rule, but information about HR 8702, information about our new fee schedule calculator that will be coming out, and some of the other issues that Kara mentioned. So please be sure to check out these links. So finally, just want to say, we know that 2020 has been a challenging and difficult year, and you as members have been on the front lines of this pandemic and have faced tremendous financial and personal stress. Please know that we are so grateful for all that you do. And so thank you for your advocacy, thank you for your perseverance, and thank you for being members of APTA.